that we are bending the curve, that we're doing it right, and that we're analyzing the data and the scientific evidence in a meaningful way so that we can make decisions. Based on that bending the curve, we can, as a parallel effort, we're going to talk about those specifics today, that this public health crisis has also become an economic crisis. And there is great urgency to be able to address both, and we believe that we can safely and productively do that. So we're going to talk about the changes to the order where we're easing restrictions. And then we also want to make sure that we spend a little bit of time talking about what the next, couple of weeks are going to look like as we get through the middle of May and what we can expect, right? Because we have to actually now work harder. This virus, as we've talked about, lives among us. It's an invisible enemy and threat. And as we look at economic measures and supporting businesses and workers and the state, we're going to have to work harder in order to support that efforts. It's one thing to stay at home and not have to wear a mask and not have to worry about gloves, and maybe you grow a lot of your own food or you have your food delivered. You live in an area where you can successfully do that. That's limited cleaning, so you're not really leaving the house. Maybe you're a retired couple, you don't have children at home, you're not trying to balance some of those issues with outdoor walks and minimal contact with neighbors, but being outside. Well, that's hard, but easy to manage. Now I'm asking you, as we talk about where we're headed, to potentially leave the house because there's other things that you might be able to do, but I want you wearing a face covering, and I want everybody in the workplace wearing a face covering, and I want signs and sanitation. And the reason I want you to do that, because if you don't, then sustaining this recovery phase will get very hard to do, nearly impossible. And in addition, it's really unfair to our economic partners who are trusting that we're going to give them good, safe practices and criteria so that they can open up again, and they're not part of a public health problem. They're helping us manage this virus successfully as we live with it for the next 9 months, because that would be the only option. If we don't do it this way, so when folks ask me why we don't just shut down everything until there's a vaccine, that's impossible to do for a number of reasons, not just economically. It's impossible. So we have to learn to do better and better and better as time goes on until there's a vaccine. And so this is what we're going to propose to do. A big thank you again to our Economic Recovery Council, who did a ton of work. We are meeting every couple of days. Kudos to the chairs, Christina Campos, who's the hospital administrator in Santa Rosa, and former representative and grocery store owner Brian Moore. Thank you very much. All right. Let's go to our first slide, which is a quick case update, because this is going to sound alarming, and it's alarming to me every day. We now have 3,411 total positive COVID-19 cases in the state of New Mexico. 198 are new today. Now, that's down from our high of yesterday, 239. It is not an indication that cases are going to continue to go down. It's an indication that we've been alerting folks. We're not through that transmission phase where cases will continue to increase, and our testing capacities, as you will hear about again, also increase. So we're going to identify and find more cases. What do we also know? There are a lot of New Mexicans, a lot of people around the world who have COVID-19 who are asymptomatic. So the more we do, the more we're going to find out about, which means the more we manage the virus transmission, the more lives we save, and that is what we're aiming to do. So we have 172 hospitalizations. We have 44 on ventilators. For folks who haven't watched this before, again, we have to know how many hospital beds we have, how many ICU beds we have, what happens when we have capacity and when surge capacity and then peak. So we have to really pay attention to that to make sure that we don't run out of the kind of care that folks who are really sick or in critical condition are going to need. We have a total of 123 deaths, 11 new today. Again, that's the most painful thing for any governor to announce in the country. There isn't a single New Mexican who doesn't mourn these deaths, and as we're seeing more and more of our vulnerable populations being preyed upon by this invisible enemy and losing their battles and their lives. We mourn with those families. It is always devastating news, which is again why the only way we protect these vulnerable populations is by working as hard as we can together. I'm going to give this number, and we're going to talk a little bit more about tests in a minute. We're going to do a little bit different because I really want to get to what is different today. So we've got well over 67,000 tests. I think the number is 67,879, and we're continuing to build capacity. And you should expect that we'll do more of that. You should expect Secretary Kunkel to remind people that we're now doing what we call more surveillance testing. But we're seeing other industries step up, get access to valid test kits, and they're also beginning to do sampling, delivering those samples to us so that we can run them and let everyone know what's going on in New Mexico, and that's a very effective partnership. All right. So here's what to expect next. Let's go to the very first, well, let's do it. The reason I hedged for a minute is I'm talking about a Navajo Nation rapid response team. I want to announce this really quick because as we go through today's press conference, we're going to be talking about all things aren't the same. The state behaves, the virus behaves. Its ability to find hosts depends upon how far people have to travel for basic services. So we know this risk. We've been addressing this risk, but you've got few cases in some regions of the state, and you've got a number, right? So McKinley County and Gallup now has more cases than Albuquerque or Bernalillo County. So these are things that we know cause great risk, and I think we can do a better job. One of the problems in addressing issues and attacking this pandemic, particularly in a place like the Navajo Nation, are the following. One, it spans 3 states. So 3 different state systems, state priorities, state testing strategies, all different. 2, like all sovereign nations, the federal trust responsibilities never been met. That means they do not have sufficient access to health care and they're responsible, federal-related services or resources. 3, incredibly rural, so rural that in fact even in New Mexico, they have limited access to running water and electricity and basic, sheltering needs, which require a population to have to move and travel great distances in order to bring that back every single day to their families. All right, so this creates unique challenges, and there are too many systems. Indian Health Service, State of New Mexico, Department of Health, University of New Mexico, Indian Health Service, the Albuquerque area Indian Health Service, the Navajo area Indian Health Service, the Navajo Nation, the 2 other states and the federal government, and our other partners like FEMA. It creates the perfect opportunity for gaps. And we have a tendency in government to sort of work in our funded jurisdictional silos. And when we do that, in my opinion, we aren't doing enough to solve a problem. So I'm announcing today that if we're going to be thinking about easing restrictions, and we are, and we're going to announce that, we also have to pay attention to our crisis centers and the areas where it's more difficult to protect New Mexicans. So this is what this does. The Navajo Nation Rapid Response Team has Kevin Washburn, former Assistant Secretary for the National Indian Affairs, Brigadier General Miguel Aguilar, New Mexico National Guard, Dr. Michelle Suina, Cocha de Pueblo, and also works with the epidemiology team in Albuquerque, Dr. Kevin English, Albuquerque Area Southwest Tribal Epidemiology Center, Dr. Paul Roth, who is the lead UNM Health Sciences and Chancellor, Dr. Leonard Thomas, leads for New Mexico and probably a region, the Indian Health Service, Dr. Alex Eastman, who is a clear partner from the U.S. Homeland Security. He's here representing FEMA and is available to us to think through any number of new strategies technologies that can really make a difference. Rosalind So with the Navajo Indian Health Service, and Dr. Sarah Lathrop with the Office of the Medical Investigator. You see that there are a ton of physicians and PhDs, scientists on this team, as well as folks who know how to move giant systems that can really create this rapid response. Our expectation as full partners is to think out of the box, to remove any of those government bureaucratic restrictions that have prevented us to acting on the recommendations and requests from the Navajo Nation, and to translate that productive effort to the other states, Utah and Arizona, and for all New Mexicans, you should expect that we will do the same thing for every sovereign nation and think about how we can have a Native American COVID-19 response team and strategy. Kind of a shout out to Representative Derek Lente, who sent us a letter earlier this week. We're on the same page, and I appreciate knowing that there are so many effective leaders in the state of New Mexico all pulling together to make a difference where we need to make a difference. It, in fact, will and does save lives. Okay, so we are announcing today that the current public health order is expiring today, right? But effective tomorrow, we have a new public health order, and I've alerted folks that it's extended through May 15th, and that the magic about that is it gives us full 2 weeks to see what's occurring, to make sure that we're bringing to you our modeling and the data, and that we can make the next set of decisions based on that scientific evidence. Because what's the goal? Everything we do has to keep New Mexicans safe. And so where are we? So what's different then if I'm keeping a public health order? What's different? Well, we're now in a preparation phase. So here's what's changing. So non-essential retailers can open up. They can do that by having curbside pickup and delivery service where permitted by their license. Well, what does that mean? Not every retailer, as an example, liquor stores, their license, their statutory oversight in the state doesn't allow that. There isn't anything I can do to change that statute. Most retailers don't have those restrictions, so now they're allowed to open their businesses and provide those services to New Mexicans. State parks, I'm clear, we're all clear. Self-isolation and isolating is very hard, and with this incredible, beautiful New Mexico weather, the fact that people can't take a day trip to a state park to just engage in any outdoor activity and the beauty of the state, we want to make sure that we're providing this. Now, I want to point out that camping and visitor centers are still closed. We will provide this in a separate press release, and will be on the website. Not every state park can open all at once, although they're allowed to effective tomorrow. We do have to staff up and make sure we do all the work to make them as safe as possible by doing the right kind of signage for social distancing and cleaning, and we will do that. Pet services. So we know that adoption and groomers and doggy, maybe there's kitty daycare too, and boarding, that's been a real stress on families and pets. We want to make sure that those services are now permitted to operate. Again, we're going to talk about the standards for that and how you can make those as safe as possible for the public. Veterinarians always could operate in an emergency service, and people might wonder why we didn't just open it up. Again, you want to manage the virus, coexist, but protect people. No unnecessary travel, trips, or businesses. That did include veterinarians. Starting tomorrow, veterinarians are permitted to operate. Golf courses. Now, I want to be really clear that where we had no state authority, there were some tribal golf courses that have been operating. I know that that's caused confusion and maybe even in your community some consternation. My job, again, is to do the best possible job in the state with the authority that I have to protect people and slow the spread of the virus. So this was an area we just didn't want people traveling to. The Economic Recovery Council and I adopted and accepted that recommendation. Golf courses are allowed now to open statewide, but for golf only, no dine-in, food service, or retail. And I said statewide, we have a state plan But if the state plan can't be met by the entire state, you will hear that later in my remarks and in this press conference, we have a region of the state that is not at a transmission phase that meets any of the gating, the federal requirements or the state requirements to meet this new public health order. So I want to be clear about that. Gun stores can now operate by appointment only. And the reason for that is too many New Mexicans need to be able to finalize their gun purchases for background checks. We recognize that, and we think this meets the same non-essential retailers criteria. They can't do curbside, but they are permitted to do by appointment only, so that changes tomorrow. Next slide. All right, so what remains closed with this instruction? Well, we still want you to stay at home. I know that that sounds like we give that message too often, but I drove to the Capitol today. I mentioned that I often do deliveries in Albuquerque to my family on the doorstep, and I go see my mother via a window, right? A wave. I can see, everyone can see, there's national aggregate data that shows you where people are traveling. People are traveling. A virus needs you to travel to transmit. You catch it, you give it. We don't want you to do that. We're staying the instruction to remain in place, except for these essential services. All right. What else remains closed? Offices, workspaces, and retailers, except for the exceptions. If you can't do curbside or delivery, and it's not an appointment-only exception, they're still closed. Dine-in restaurants and bars, except for curbside delivery, are also still closed. I'll tell you what we believe based on the contact and the time you spend there, which Dr. Scrakes is going to talk about. We made these decisions not based on the business, but based on the safety of the public and the safety of the employees there. We'll show you how we did that using an evidence-based model. Here's what's still unsafe and closed. Indoor malls, gyms, salons, theaters, and casinos. Mass gatherings, still prohibited. And the 14-day quarantine order remains in place for all out-of-state airport arrivals. All right, next slide. So how do we then move to the next phase? All right, well, we're going to continue to use the modeling by the medical advisory team, so you're going to hear more about that. But we analyze the spread of the virus. Where is it? How quickly is it spreading? What are those rates and ratios? And that's how we'll keep making decisions. So can you help? You bet you can. The more you restrict, even with opening, and we do want to ease the relaxing of these restrictions, we hope is good for business. We hope it's good for individuals too. We have to marry these safe personal practices, or we'll see a spike that's not anticipated, and that's when you're not prepared. Emergency preparedness means knowing what's going to happen. We are going to see more cases. Even without relaxing restrictions, we're still in that phase where we're going to see increased cases. We want to keep them below a certain percentage. We see how they're transmitting, what that rate is, where it is. As long as that curve statewide still is flattened, then we think that we can make these decisions safely, which is why we are. We have to continue having adequate and stable testing, and that's measured by the Department of Health. Quite frankly, we have a lot of partners doing testing now. Actual testing and running the tests. But the Department of Health is leading that effort. It's an incredible undertaking, and they will have to continue to do that. Effective contact tracing plans and resources, that's going to be measured also by the Department of Health, and they have a very specific division, population health experts, doctors, and scientists. That's the epidemiology division. That division has to have, they will tell us that they believe that we can do sufficient contact tracing. And I know that that sounds easy. I have COVID-19. I was identified as positive. Here's the family members I was around. I'm not working, and I went to this grocery store. I didn't touch anyone. We're done. But no. You have to really think about if anybody else in the household, if you went for a walk, if you were in a car with someone else, what grocery store, where in that area, how close did you get to it? We have to do all of that work. And while we're moving to that digitizing phase of this work, it is still a lot of personal contact. So it's incredibly time intensive. And for places in New Mexico without broadband and telephones, it is even more challenging for a rural, vulnerable minority population. So it's a huge undertaking, but we are well on our way. And the healthcare system capacity and personal protection equipment levels, that's also measured by the Department of Health and by the medical advisory team. I keep pointing to my two experts and leads. That will be analyzed all of the time. And if that doesn't stay stable, what does that mean? That the healthcare system can take it, that we have enough equipment and support, then we can't go to the next phase. So we'll have a phase 1, more relaxing. Phase 2, more businesses, more economic recovery. Phase 3 means we're closing in on a vaccine and we feel like it's completely back to normal with this. Everyone on the globe has learned the lesson about a pandemic. They can strike again, likely will, and we just have to start thinking about our own behaviors.